Dr. Githinji, I think it's still in order to say Happy New Year.
Happy New Year.
Until it ends in, the year becomes old in February. So January is still...
It feels very old already because there's even no distinction between last year and this
year.
All we know is it's a COVID period. So.
True.
But Happy New Year.
Happy New Year. And of course, just before this, we're talking about the fact that last year you turned 50. And what a way and what a year to turn 50, Dr.
I will never forget it.
You know.
So it's actually a turning point.
I'm telling you.
Exactly.
A virtual party that had to happen
virtual Zoom party that happened.
Wow.
No travel. And maybe in a way, I turned 50 when I could actually be grounded here in Kenya. I could have been needed to be traveling when I was turning 50. So there are many things that that we can say worked for the 50th birthday. But obviously for the world, it's been a time of turbulence.
It's been a roller coaster and a half.
Roller coaster.
Let's come now to 2021.
Yes.
We are starting the year as we talk about vaccine trials and who will get the vaccine and who doesn't. As we're talking about that, UK scientists say, hold up. This new strain that we're seeing from South Africa might be resistant to the vaccine. How do you go from here, Daktari? Because the vaccine was supposed to be the solution moving forward. How does it pan out in 2021? Each month, a new vaccine, a new strain for that vaccine. How do you see this playing out?
No, I'm not worried. The reason I'm not worried is because vaccine mutations, because when you talk about the new strain, it means you have the virus, but it has changed a little. So vaccines or viruses are always changing. They are always changing, tens, hundreds of times. But there are specific changes that then may make it significant for us from a public health issue. I was just at a meeting where we were discussing that one, the key issue that you need to watch out for mutation, because the mutations are normal, is does the mutation change the infectiousness of the virus, or does it remain the same? Or does it change the severity of the disease, or does it remain the same? Or does it change the ability to diagnose it, or does it remain the same? Or does it change the effect of vaccines? So those four things you need to watch. Now, the current strain, we have seen it is more infectious, so it is a worry. It is said to be 50 to 70% more infectious. What does that mean in lay terms? It means that an individual who has the virus, originally we knew that you'd infect maybe 1.5 to 2 people per each infected individual. We are saying 7% means that one individual could now infect more than 3 people. So it's more infectious. It is not known to be more severe. And in many of the studies, we believe that it will not affect the vaccine. And it's not affecting the diagnosis. So the reason I'm saying that is the worry that this vaccine will escape the vaccine, that this virus will escape the vaccine, I don't think is founded until we actually do proper trials on it.
Right.
Yes.
And it's interesting you say that because even as you speak about the vaccine, CS Mwangangi had spoken about when they get it probably mid-February, these are the people who we see getting it first, frontline workers, people in the military, defense forces, NIS. How do you see that playing out and the whole rollout of the vaccine this year? What's your prediction on how Kenya deals with that? Because managing the vaccine, even when you get it, is a whole other kettle of fish. How do you see that?
No, you're right, because as we say, vaccines don't save lives. It's vaccination that saves lives. So if you have vaccine in the store, people can still die.
Right.
So the process of getting the vaccine from the store to the human body is very complex.
Right.
The first thing you need to ask yourself when you get the vaccine here is, first, who is priority? Because the vaccine, and even when you look back at other vaccines, not only COVID, there are vaccines that are given to specific groups. And when you look at the TB vaccine, BCG, is given to everyone. Look at polio, is given to everyone. When you look at the human papilloma virus for cervical cancer, it's given to school-going children, girls. So there are particular groups that receive. So for every vaccine, and the flu, if you look at Europe and America, they recommend it for people above a certain age because there are people who are most likely to get severe flu or influenza. So the COVID vaccine is no different. So the first question to ask is, who are the people who are most at risk? And it's the one you've mentioned. So we have the elderly. You can decide to cut over 65 and above. Kenya, I've seen us talking about 50 and above because, again, our elderly are not too many. Only 3% of the population is above 65.
Okay. I want us to move from the COVID-19 and the vaccine to you as a doctor and what's happening with doctors in the country right now. They have downed their tools yet again, and it seems like if there was ever a time the doctor's plight could be heard, this was a golden opportunity. And they're really asking for what many people say is the bare minimums, but yet they're still in contention with the government. The nurses have gotten into that particular fray. Laboratory workers have also jumped into this particular space. You're the co-chair of UHC. How does this impact UHC for this year? Because clearly we want to vaccinate frontline workers. There might be no frontline workers to vaccinate by the time the vaccines come.
Yeah.
Yeah.
So a complex issue here, very, very complex. The first thing is that there is no overemphasizing that a healthcare system that works needs healthcare workers. And healthcare workers are all cadres, not only doctors and nurses, even the person who works in the laboratory, even the pharmacy, the person who sweeps, the person who has actually administers or works on health data, all those people are healthcare workers. And all of them are needed for a strong, resilient health system. Now, when you have that, then you add on top of this the fact that in Kenya specifically, health is devolved. Okay? Being devolved means that the counties have the key responsibility for all the elements of the healthcare system. Remember, the healthcare system, other than health workers, has other building blocks. Those building blocks include commodities. The KEMSA issue includes availability of laboratory reagents, includes service delivery points where people go to seek healthcare, includes information to decide who needs what when, includes leadership and governance. There are all these elements. So healthcare workers are just one part of the 6 building blocks, or 7 or so, because I like to add people as part of the healthcare system as well. So it is a very complex thing. Now, when you put these together, then you hand them over to the counties. Now, the counties then, you give them money that is not ring-fenced for healthcare. The revenue share that's given to the counties is given as bulk. It is up to them to balance the needs between agriculture and health and education. So the first answer to your question is not the doctor strike or this or that and how it's been resolved. It is how we finance the healthcare system as a whole. Because what we are seeing with the strikes of healthcare workers is a symptom of actually a larger issue. The larger issue is that we know that healthcare financing is supposed to be at least 15% of our overall country expenditure. Where is it now? Under 7%, just shy of 7%. So that's the first issue that needs to be addressed, because if that issue is addressed, you then be able to employ more health workers, and the ones who are there would feel less pressure, and therefore you'd reduce the industrial action. Because part of the industrial action is people saying we have overworked, it's going on. But if you had more health workers are needed by ratios, then you have less pressure. So it's a bigger issue. The second thing on top of this is, how does the money flow? When you send money for health, because it's a devolved system, and you send it as bulk, then when does the money reach the facility? You've had the issue of PPEs. Now, the thing around PPEs is this. Is there a button you press at the Ministry of Health and you resolve the PPE issue across the country? None. Okay? Because PPEs are a daily use issue. It is like saying we want more water. Now, the water, even if you dug a borehole, needs to leave the borehole, go to the home. Then there needs to be, a dispensing center. There needs to be available clean water all the time. It's the same with PPEs. So even when you say we want more PPEs, it is about the flow of money. Because one county may have the money, but decide to put it in education. Okay? Another county decides we'll actually go and buy PPEs. So even if the money was available, you have to resolve what we call the flow of money to the facility, because the facility is the one to decide that Dr. So-and-so needs a mask tomorrow. You cannot base the supply of PPEs on a centralized county procurement system, because PPEs are used every day. Okay? So the issues are so complex. They're not about the doctor strike. So for me, what the country needs to do, and I've called upon this, I've actually publicly said, we need a national health workers conference where the county governments come on the table, the national governments come on the table, the health workers of all cadres, not doctors or nurses, come on the table, and then the media comes on the table, and the issues are discussed openly. What are the issues? And these issues are raising here, and then discussed, and the media starts to understand that actually the PPE issue is not the Ministry of Health that has refused to supply. It is that even if they supplied, how do they flow to the person, because health is devolved? So there are so many other issues that need to be addressed. And I think that if those issues are addressed, these are the issues around the doctors and nurses and clinical officers. Should we also wait for lab technologists to go on strike? Should we wait for sweepers to go on strike? Should we wait for data clerks to go on strike? It is actually a holistic issue.
Right. For you, from where you stand, what are the vital signs you're monitoring for 2021? From January where you are, what are you keenly looking at as we get into the year proper?
So the first thing, of course, is to always start with health access. That's the first thing. So to say that the first thing I'm monitoring and checking very closely is that more and more people have access to healthcare without having to worry about how to pay for it. That's a very clear number. Right now, we have more than 1.5 million people who fall poor every year because of health bills, every year. So I'm monitoring that. How many more people can we save from poverty by providing access to healthcare without having to pay for it, sell their cows and their land? That's the first thing. The next thing is obviously to monitor the pandemic itself. You know, how are we moving in terms of controlling this, the wave, in terms of ensuring that we have a low infectivity rate so that we don't overwhelm the health system. So that's the other thing that I'm looking at as a sign. And of course, now we see the wave go up, 16% infectivity, now we're down to 3. So monitoring that very closely. The third thing is actually to monitor health system capacity. Because if you don't have a good health system, even a small wave will overwhelm you. So the health system capacity is something you're monitoring very closely. And this means how many community health workers do we have who are able to serve communities? How many nurses and doctors and clinical officers and lab people are available to serve communities? And how are they well financed? So the financing is another index. Are we going probably to look at increasing our allocation to health in the next budget? That's another index that I'm monitoring. Right now, if you're operating at 7, is it likely that the government, from the experience of the pandemic, is going to look at increasing the amount of money allocated to the health sector by probably moving from 7% towards 8 and 9%, which will be a first in Kenya. And of course, when I talk about this, not only national government, because I said counties allocated bulk money, and they spend about 25% of that in health. So if they could increase the 25 of their own allocation to 30%, and the national government increases its own allocation to Ministry of Health for special programs, then we can reach the 8 towards 9, because we are looking to get into 15. So again, that's another index that we have to monitor. Of course, there are so many other things about that affect healthcare, like how do we move towards a multi-sectoral approach to healthcare? Because as you know, health is not about hospitals and Ministry of Health. If you don't provide clean water and sanitation, you have no health. If you don't take girls to school, you have no health. So all those are the sub-factors that we'll be monitoring this year.
Okay, we leave it at that, of course, and we shall circle back in December,
yes,
right under this beautiful tree, and have this conversation again.
Thank you.
Okay, thank you so much, Doc. Have a good
Anytime.
year.
Thank you. Same to you.
Fantastic, fantastic.
Asante.
Okay.